Okay, I want to thank everyone for being here. This is our Wednesday evening, 7:05 p.m. home health orientation. And the purpose of this orientation is so that you, the viewer, can be educated as to the principles and practices of chiropractic and how to use the cervical extension traction unit. In a moment we'll be showing you that, but first I want to back off and give you some philosophy of chiropractic care. Who made this quote? The doctor of the future will give no medicine, but will interest his patients in the cause of the human frame, in diet, and the cause and prevention of disease. That's right, it was Thomas Edison, an inventor back in 1847. I just want to let you know that an inventor, someone who's a free thinker, thinks out of the box, even knew the basic principles of chiropractic care way back in the 19th century. Now, what I'm going to do today is introduce you to some of the basic concepts of chiropractic. What generally drives a patient into our office is pain. But when you go to a medical doctor, if you point to the area of pain and you say, "Doc, it hurts me right here," what does the doctor do? He examines that area, takes a needle or some kind of medication, he injects it, and all of a sudden the pain is gone. But it's only for a temporary period of time. Soon enough, within 2 to 3 months, that pain comes back. So the point is, it's a temporary relief, and medicine has been a temporary reliever of pain because it only gets at the symptom. Chiropractic care gets at the cause, and as you can see in this illustration, that the iceberg, the portion that's beneath the water, cannot be seen, and that's the most dangerous part. So a little more investigation has to go on in order to find out what is supporting this tip, and that's called a chiropractic assessment. And what are we looking for? In the spine, we're looking for tiny misalignments in the spine known as subluxations. Subluxations are bones out of place pinching nerves. They reduce the overall state of health and reduce the normal function of the nerve system. Now, Guyton, in his book, Anatomy and Physiology, said that the nerve system is the master control system of the body. It controls and coordinates every body function. So if the cause of symptoms is a subluxation, how many of these do you need? That's painkillers. How many painkillers do you need to correct the subluxation? The answer is, it can't correct the subluxation. You can't use a chemical solution for a physical problem. You need a physical solution, and that's where the chiropractic adjustment comes in. Chiropractors remove the cause of sickness and disease, not temporarily relieve the pain through medication. And by the way, that's why they put 100 pills in a bottle of aspirin, because you're going to have to constantly take them to relieve the symptoms, never getting at the cause. Now, the spine develops in the safety of the womb in a C shape. But then, over time, that same spine, when you're born, starts to form and take on another shape. That's the first curve in the neck. We call that curve the lordosis, or the arc of life. The arc of life, a very important principle, because all nerves have to go through the arc of life in order to get down through the rest of the body, and we'll mention that in a minute. Then, as the baby starts to crawl, they develop another curve in the lower back. Please, you young moms and dads, allow your children to go through this phase. This cross-crawl pattern is very important in the development of the nerve system. And then once that body is able to support itself, they'll know when to stand up, and that spine that has all the proper curves will be strong and healthy and functioning.